Great, and with that, we will open it up to questions.
Julian, could you please give us a ballpark figure on the additional Medicaid funding for abortion and family planning?
Yes, so,
Sorry.
no, that's okay.
Spam.
The abortion rates would cost $3 million, and the family planning rates would be $300,000 annually.
Would the $3 million be annually also?
Yes.
Which of these proposals do you think are going to be the most controversial for you to get through?
Well, you're speaking to a group of 60 who supports them all, so we're hopefully none. But as you know, this issue does have supporters on both sides of the aisle, and so we'll just have to see.
Gillian, earlier news conference, we asked you about viability. Is there going to be any sort of examination of viability in the 2024 session?
Not in the 2024 session.
Okay. Why not?
That response was in, if we are to move forward with a constitutional amendment in this state,
Yeah.
then we would want to look at the arbitrary notion of viability.
Okay.
But we don't have any proposals specific to that discussion.
Well, I mean, GAE did vote to draft Representative Blumenthal may have some insights.
Yeah, so thanks for the question. GAE did raise a title to look at a constitutional amendment to deal with reproductive freedom along with the right to privacy and updates to our ERA. And so I think the conversation we were having in the previous press conference related to that, in that there is, when you're writing a constitutional amendment, it matters what's in it and what the details are. And so that's one of the conversations that might happen around such an amendment, which is that there's individuals likely who may want to not restrict that conversation to viability. There may be others who do. And so I think that's one of the things that is attendant to that conversation is that there is potential, I'll say, there's potential conversation around that line. So,
as far as the Alabama Supreme Court ruling that you were just speaking about, what if any implications are there for here in Connecticut? I don't see how the Alabama Supreme Court's ruling would affect anything policy-wise or legally here in Connecticut, but.
Yeah, as a strict legal matter, obviously the Alabama Supreme Court's ruling doesn't actually have a direct impact on Connecticut law. That being said, I think it's an indicator of the extremism of politicians in this area. And I think that if a Alabama Supreme Court is willing to completely eradicate IVF in the state in the language that it did, I think there's no doubt that there's Alabama prosecutors who'd be willing to pursue providers or individuals who participate in reproductive health care that's legal here in the state of Connecticut, regardless of where they are, including if they're located here in the state of Connecticut.
Then wouldn't the safe harbor law kick in at that point?
Yes, under most circumstances, but I think it indicates both the urgency of us making sure that that law is as robust as possible, and us also ensuring that we ensure that reproductive health care across the full spectrum of that health care is available and accessible as much as possible in the state.
I got here late, so I apologize. Is the amendment, a constitutional amendment, is that part of your legislative priorities? I know the Senate Democrats the other day announced that it was a Senate Democratic priority, but I don't know about, like I said, I got here late, so.
It is not part of our priorities. We still don't believe it's necessary. If we were to move forward, we'd want to look at an expansion of the Equal Rights Amendment. And then, as Representative Blumenthal mentioned, we'd also want to have that discussion on the definition of abortion.
Okay, thanks.
Can I ask you, over the years, Congress has moved away towards a lot of federal funding for abortions. Do you think that there will be some who will be concerned that any kind of Medicaid state funding is going to be used for that? I'm going to assume there will be.
So we currently allow state-funded Medicaid to cover abortion. We just haven't increased the rates. And so this would increase the rates.
What do you mean by the rates?
The amount that the provider is reimbursed for performing the medical procedure. And so those rates haven't been increased since 2008.
And is that a hardship, as you've understood, that because of the reimbursement rate, that it's not feasible to do them?
It is. The providers are telling us that they've seen an increase in individuals seeking access to abortion, both within the state and out, coming to Connecticut, and their costs have continued to rise. So security costs, healthcare costs, and yet we have not increased how much we reimburse them for the abortion procedure.
My question, I guess if you're coming from out of state, there may be people who can pay and can't pay. Does that factor into all of this, and is a reason why that they would like a rate increase?
So I do believe our largest abortion care provider in the state does offer a sliding scale, but to your point, it really does depend on how much an individual can afford to pay.
On infertility coverage, did I see a bill introduced in public health or raised or I thought I saw something in the last week on that.
So in the last week, 2 bills have been raised, one in Human Services to address the Medicaid piece, and one in the Insurance Committee to address the underlying care itself.
And what bill is this that you're specifically talking about?
The fertility or the...
The fertility?
So the fertility would make fertility care more equitable in the state by shifting from an infertility model to a fertility model so that those in the LGBTQ community, single women, those who experience medical conditions, and those on Medicaid would be able to access fertility coverage. And so that's in 2 committees at this point.
And they
Which number
cannot
is
now.
that? Bill number.
I don't believe it has a number yet because it just got raised. Those numbers will come out.
And they cannot now.
So currently, we are working off of an antiquated heterosexual infertility model, and Medicaid doesn't even cover that.
You want to? Well, the implications of the infertility model is that you have to prove that you're infertile. So you have to be trying for a certain amount of time. Now, obviously, there are lots of people for which that does not make sense.
So
Yeah.
I just want clarification on Susan's question. So obviously, like, you're looking for the providers to get more money for performing the abortions. Are they turning people away because they're not getting as much as they want right now and they can't afford to do more abortions? Or like, why is this benefiting the patient for the providers to get more money?
So they're not turning anyone away, but it does delay care. So there are waits, and with a time-sensitive procedure like abortion, we want to ensure that folks can get access right away. They're also losing money because, again, their costs have gone up. And so we want to support our healthcare providers by paying them what they're owed.
And that $300,000 annually for family planning, like specifically, how is that going to help people?
So currently, that one's an interesting one. So currently, the Medicaid rate, there's a differential for family planning providers in a private OB/GYN versus in a clinic. And so really, we just want to equalize that reimbursement so that any family planning provider, regardless of where they provide that care, gets the same reimbursement. And again, it's about access. So by not being able to pay staff, there's delays in care. And so we want to ensure folks can get the care they need in a timely way. Any additional questions? Well, thank you again for all being here, and thank you to the Reproductive Rights Caucus for working on this robust, proactive agenda. Thank you.